What excites me the most about our future of delivering complex pediatric care at ViveWell Health is that we have the potential to literally transform the opportunity of an entire generation of people. People who have been sidelined in life can have the chance to fall in love again, to have a successful career, to have meaningful relationships, and to achieve their maximum potential. Hey, this is Dr. Ben with ViveWell Health. I'm here to talk about our complex pediatrics. This is advanced diagnostics and treatments that are not available at most other institutions. It's a big picture. What we see is there's compounding genetic effects on children and massive environmental issue, whether it's environmental toxins or metals or mycotoxins, or in some cases vaccines could be involved. It ends up causing, in certain people, a complex inflammatory situation where the kids that we love aren't doing as well as we had hoped for. We oftentimes have a number of root causes that could be contributing to this, whether it's, gastrointestinal stuff like leaky gut or food inflammation. Certainly a lot of people are having sensitivities to different chemicals and dyes in the food, or whether it's ultra processed, or maybe your kid, it's dairy or cashews. We're seeing kids who have Lyme illness or Epstein-Barr toxicity, or we have a number of children who, after they've gotten vaccines, things didn't seem right for the parents. So we've been able to help people with stem cells or exosomes or advanced testing. The Complex Pediatrics service line here at ViveWell Health is super important for helping families who are struggling with sick children. This is something that's near and dear to my heart because as a parent, I've had children who had unexpected illness, and we've learned how to go through the different layers of figuring out that there was an unresolved strep infection or mold illness, or that we took our family camping and ended up with Lyme disease. It goes further and further as people realize that sometimes there's autoimmune illnesses involved, or people may have certain neurological or behavioral things, or abdominal pain that's just not getting better. As a parent, I've experienced a lot of these concerns and worries. In traditional clinics, there's typically a standard prescribed way to handle things. Most pediatricians are trying to keep kids on a vaccine schedule, and if children are sick, there's a standard testing, whether it's for strep or certain viral illnesses, and then people are just sent home to just kind of see if they get better. ViveWell Health sees things differently. What we're looking at is really the whole picture, not in an acute care or in a standardized process, but really looking for an individualized plan for this child. So we have to take into account the immune function, the gut function, child's vaccine history, the environmental situation. Oftentimes people had some sort of triggering event, whether that was a flood in their home or a family vacation where everybody got sick down in South America, or we've had children who were born premature who required supplemental oxygen since they were born. We've had other children who had head injuries and everything changed for them as well. So there's a number of things really to take into account. Parents come to us because they want a holistic approach in looking at their children. This includes looking at the gut microbiome, or looking at inflammation, or they want a provider who's not going to force them into something that they don't want to do. They want a second opinion. They've been given medical advice that didn't resonate with how they wanted their child treated, or they'd had numerous people tell them that all the tests were normal when their child clearly wasn't okay. But unfortunately, what we're finding is all these people who come in with chronic inflammatory or autoimmune or cancer, that we can typically use our reporting to pull up articles to actually prove to people that the things that are stuck inside them are the reason they're so sick. I think we've learned a lot in the last 5 or 6 years that what we thought was healthy before isn't necessarily so. Unfortunately, as we continue to learn more about how forever chemicals and plastics and food dyes and synthetic clothing and the list keeps going about how this stuff is accumulating within us, or how maybe what the institutions that we thought were supposed to protect us are really letting a lot of things fall through the cracks because there's no law against it. There's a lot of things in the environment that are really unhealthy, and it seeps into our everyday lives and becomes a cumulative burden on people's health. And to be honest with you, we've seen people who got additional testing and have seen their children transform through some of our treatments. We've been able to uncover some pretty dramatic instances of how kids maybe fell through the cracks, and now we're able to offer an opportunity for this child to really live a fulfilling life. Truly, it's something that for me is near and dear to my heart, because as a parent, I've experienced a lot of these concerns and worries. So this has been an amazing experience to partner with parents because my kids were sick. I've gone through the process of finding yet one more thing to pay attention to and trying to figure out how to, give your child who's already not doing as well and complaining how to stack certain medication treatments and whatnot. And it can be scary and overwhelming. What I'd like to do is to offer a sense of hope to families that there's somebody who's both gone through things, also is willing to go the distance and take whatever steps is necessary to help your family.